All right, now this is the third video in our series on how to help improve elbow pain as golfers. And as I mentioned in the first video, and possibly the second too, whenever you have pain in any part of your body, the muscles in that area get weak. They stop functioning properly for a couple of reasons. One, the inflammation from the injury slows down the nerve impulses from the nerve to the muscle. And as we all know, nerves control muscles. So if those impulses are getting to the muscle slower, then the muscle is obviously not going to be contracting properly. And whenever a nerve slows down its impulses to a muscle or loses connectivity in some way, the muscle begins to immediately atrophy or weaken. It is just a crazy fact of life. It's something that we as physical therapists deal with every day, trying to help our patients get better. And of course, us as human beings deal with it too. And because I'm struggling through this lateral epicondylitis right now in my golf swing, I can feel like when I go to shake someone's hand, like my grip is weak, it's painful to do, and I'm really trying to get that strength back. So one of the exercises that we like is just a really slow wrist extension. And the reason I'm leaning on my treatment table is I want a solid surface to do the exercise from. So I'm gonna get my whole forearm on that edge of the table here. I'm gonna let my wrist bend all the way down. So I'm getting a good stretch across the back of the wrist. Then I'm gonna raise my knuckles up towards the ceiling. And as you can see, I'm going nice and slow. I'm holding at the top, and then I'm slowly lowering, and then I'm gonna hold at the bottom too. That holding is really important. It stimulates the tendon in a very specific way to help it heal better. So I like 5-second holds, and I'm gonna travel up slowly through that range of motion. I'm gonna hold for 5 seconds at the top again. The reason I'm going slowly on the down phase and the up phase is that so I know that I'm in control of the contraction. So many people exercise too quickly when they're rehabbing. We wanna go slow so that we don't use momentum as a way to cheat the movement pattern, okay? So it's really important that you work through these reps slowly in a controlled way so that we're actively stimulating the muscle to grow and get stronger. We're also stimulating the tendon to repair itself and heal, which will make us feel better and happy on the golf course. So I like to do this until absolute fatigue or the pain gets to be so much that it's actually starting to bother me. Both of those things can happen independently. They can also happen at the same time. So be aware of how you're feeling, and I don't encourage people to count reps with these. I want you to just go until you're tired or the pain increases to a point where it's like, yeah, it's getting kind of annoying. I'm going to stop now. Because I totally get it. When you have lateral epicondylitis, as I do right now, it kind of hurts all the time. So how would I know when it would be safe to do an exercise? I mean, basically what I'm trying to do is I'm trying to not elevate the normal pain that I'm feeling at all during the exercise. So I'm keep going here. I'm not tired yet. And I want you to try this at home. If you have any questions, just reach out and let us know or message us below.